Well, good afternoon, everyone. I'm very pleased to be joined by the Minister for Health, Greg Hunt, and the Minister for Senior Australians and Aged Care, Ken Wyatt. One of the hardest decisions any Australian makes is when they're entrusted with the complete care of their partner, their husband, their wife, their mum, their dad, their auntie, their uncle, niece. These are hard decisions. We make a lot of hard decisions in this place, but that would have to be one of the toughest decisions you make. They are relying on you 100% in their time of greatest vulnerability about the decisions you're making about their care. Every Australian who makes that decision, and for every Australian whom that decision is being made for, they deserve to have great confidence about the care that their loved ones will receive in our aged care sector, our residential aged care sector, our in-home care provision of service. And that also includes young Australians with disabilities who live in a residential aged care facility. Over the past 3 weeks, coming into this role, you would appreciate that I receive many, many briefings. There is a lot of information that's presented to you. One of the briefings and one of the sets of information I just could not get past was what was occurring in our residential aged care sector. As a result of the work that the government has been doing, the unannounced visits, the compliance audits, it has revealed a very disturbing trend in what is happening in terms of non-compliance and abuses and failures of care that have been occurring across the sector. Now, that said, we know that across our residential aged care sector and in-home care, we have some of the finest facilities anywhere in the world, indeed better than anywhere in the world. Indeed, this is an area of export growth, actually, training of services, building of facilities. This is something that Australians are very good at. And I want to pay tribute to all of those who work in these facilities. I and Ken and Greg have visited many of them, as you'd have expected, as local members, as ministers and treasurers, as Prime Minister. And what that says to us is we've got great people doing a great job, and they're a great team. But every great team wants to do better. Every great team wants to be able to ensure that where there are problems in their sector, in their industry, then they want them to be addressed. A 170% increase in services with serious risk identified in the past year. A 292% increase in services with significant non-compliance. One service being shut down by the Department of Health every day. 154 notices of non-compliance. That's an increase of 185%. Sanctions up 136%. That's impacted some 2,000 residents out of what is a standing group of just over 200,000 who are living in residential aged care and over 80,000 who are living in in-home care support, including those who've received that in retirement villages. 2,000 residents were impacted by that. Some 300 had to be placed in other services. So when you're confronted with that, you ask a simple question: how widespread is this? How far and wide does it go? Does it touch on the whole sector? Now, until we can have clear answers to those questions, I think Australians will be unsure. And that's why, as Prime Minister, last week, we discussed this together as a cabinet, and we decided it was necessary to move forward with a Royal Commission into the aged care sector, which includes the care provided to young Australians living with disabilities in the residential aged care sector. It is our intention to keep doing what we're doing, and I'll ask Ken to talk more about that. We're not going to stop and wait for this Royal Commission to finish before we keep getting on with the important work that we're already doing. We will walk and chew gum at the same time when it comes to this issue, and that is important because there is great work that is being done, but more needed to be done, in my view, and that's why I've brought this forward. Secondly, we've got to take the politics out of this issue. I spoke to the Leader of the Opposition last night. We've had good bipartisan support when Labor was in government and when the Coalition has been in government. We want that to continue. And we want the issues to be identified as the facts. We want there to be an impartiality to this. We want political agendas taken out of it. So let's get an independent, credible, honest look at what's happening in the sector, and let that be the basis for our continued working in partnership all around this place, focusing on the care and needs of Australians and the choices Australians are having to make about aged care. And that will be an important opportunity, I think, with this Royal Commission to ensure that that's the case. And when you pull all that together, I think, combined with the work that we're already doing, we will be in a better place to be able to give Australians the assurance that they're seeking. Now, the Royal Commission terms of reference will be worked up over the next few weeks. We'll be consulting with the sector, of course, and we'll be listening carefully. As various teams around the country are preparing for the finals, we'll be preparing for this, the terms of reference, to finalise the commissioners and the model that will be used to pursue this Royal Commission, and to finalise that terms of reference ultimately in the letters patent with the commissioners that are selected. So there's a lot of work to do there, but to just run through what we expected to cover, it will be as follows. The quality of care provided to older Australians and the extent of substandard care. The challenge of providing care to Australians with disabilities living in residential aged care, particularly younger people with disabilities. The challenge of supporting the increasing number of Australians suffering dementia and addressing their care needs as they age. The future challenges and opportunities for delivering aged care services in the context of changing demographics, including remote, rural and regional Australia, and any other matters the Commission wishes to pursue that they believe is necessary. So the issue isn't just in metro centres or just in rural centres. It's not just in for-profit or non-profit. It's right across, as best as we can determine from the compliance work that has been done today. So we do want to look right across the board at what is occurring. So I want to thank particularly Greg and Ken for the great work they've been doing in this area. You know, you put a cop on the beat, they're going to find the problems. That's why you put the cops on the beat. So these figures that we've seen today are a result of taking that action, and then you ask yourself, well, what do you do next? Well, you do this. That's what you do. Greg.
Thanks very much, Prime Minister. Scott's right. One of the hardest decisions and one of the highest responsibilities that anybody can take is to see that their parents have the best care at the moment they are going into care. I know that as a son. 6 years ago, we were looking at the circumstances for my own father, and I remember the weight of the decision, and I remember the absolute focus that myself and my family put on that. We were lucky. We had tremendous care, and the overwhelming majority of Australians in care and of sons and daughters who are looking to care for their parents are able to have absolute confidence that their parents are getting the highest quality and standard of care that they can. But we also know, precisely because of the work that has been done, that we have seen an increase in evidence of cases where not everything that can be done has been done. Not everything that should be done has been done. We know from the work of the Quality Agency that we've gone from 2 to 22 to 61 cases identified where facilities would have residents at risk over the last 3 years. In the last year, that's a 177% increase. Now, in part, that may be a case of changing practices, but in particular, it's about shining a light on the challenge and then recognising what that challenge is and responding to it. So that's why we need to deal now on a level never before done with the challenges facing the current sector, where the overwhelming majority of facilities and the overwhelming majority of staff do an amazing job, but we need to give all the support we can. But looking forwards to the future, which is also a key part of the Royal Commission, we know that from 2015 to 2055, there will be an almost fourfold increase in the number of Australians over the age of 85, from 500,000 to 1.9 million. That means we will have a systemic demographic challenge on a basis never before seen in Australia, so we need a systemic demographic response. In other words, this Royal Commission is about the safety and quality of care for Australians who are in facilities and receiving Commonwealth care now, but it's also about ensuring that we have a system that is planned for to last for the coming decades.
Thank you, Greg. I'm going to ask Ken to talk about how we've got to this point here, but also how the Royal Commission will be supporting him in the important work that he's doing.
Thank you very much, Prime Minister. I want to say it's an incredible privilege representing, in many senses, senior Australians who've given this country everything that it has. And in our work, which commenced with the roadmap co-designed by the aged care sector, we've made significant reforms. But following Oakden, we went one step further and we looked at the circumstances that senior Australians found themselves in their vulnerable state of both frailty and in their mental state. What was important was bringing together the relevant agencies to provide an organisation that focuses very sharply on the quality of care within residential care, but also home care. What's important is that we look after the mothers and fathers, uncles and aunties of families who are in aged care. When we talk of a crisis in aged care, I don't see it as a crisis in aged care per se. I see it as a crisis for the families affected, the families who expect that the love and attention will be given to each of those entrusted to a provider. I have no compunction saying that I would stand beside and support the workforce that is in the aged care sector. They are an outstanding, compassionate group of people whose commitment to looking after senior Australians with love and devotion, so much so that I see some of them at the funerals attending and acknowledging the passing of a significant Australian. So we will continue to work towards a workforce that we need for 2050. That workforce activity will be undertaken by John Pelaez, working with the sector, so the sector is redesigning its thinking and its direction for the workforce it'll need. It will consider not only horticulture, which are the gardeners that work within their facilities, but the whole spectrum of people involved in caring for senior Australians, including those careers that will evolve with technology and with artificial intelligence. But we as a government are committed to making sure that when you put somebody into a residential aged care facility, they are given all of the assistance and care that they need. I want to make a point that there are 2 points in our life in which we are frail. When we're born, we are frail, and we rely on others to nurture and to love us and to provide the growth that we need. The other point is when we become frail and aged. At that point, we need to ensure that that same consideration is given to senior Australians. I've been into more than 100 aged care facilities across this nation. I have talked with senior Australians about their hopes and aspirations living in their home, living with people that look after them. So this Royal Commission will enhance and complement the ongoing work that we will continue to do. It will look at the systems systemically, but equally we won't take our eyes off the way in which we consider the needs of all senior Australians. Thank you.
Thank you, Chair. The man to your left told Four Corners a few short weeks ago that a Royal Commission would be a waste of time and money. A Royal Commission, after 2 years and maybe $200 million being spent on it, will come back with a very same set or very similar set of recommendations that the governments will respond and put into place similar bodies. Haven't you just thrown him under the bus here with a needless Royal Commission, as he regards it?
I believe it's important to do this Royal Commission. I've consulted closely with my colleagues and we all believe it's important that it be done. I'm not going to get into those sorts of comments. I'm just going to focus on supporting senior Australians and ensuring that their care is up to the standard they all expect. I'm not interested in the politics of it. I'm not interested in the media commentary on it. I'm only interested in the care provided by senior Australians. Phil.
PM, you've also flagged a Royal Commission into the energy sector.
I couldn't hear you.
Sorry, you've also flagged a Royal Commission into the energy sector.
I just said I wasn't ruling it out.
Not ruling it out. What would be your trigger point for calling that?
Well, again, I'm not ruling that out, but the difference here is that the residential aged care sector and in-home care arrangements, plus those younger Australians living with disabilities in residential aged care, these are areas where the Commonwealth is directly involved. I mean, we're spending $1 billion extra every year on aged care in this country. We've increased the number of in-home care places just recently by 20,000 in the last MyEFO in this budget. And over the forward estimates, we will go with high care places at-home care from around just over 40,000 to over 70,000. So this is an area where we are very much involved. There are other parts of this sector and retirement villages and things like that where state governments have their responsibilities. We will be being responsible for what we're accountable for and making sure that we act in those areas. So this is very much a core area of both fiscal and direct service provision responsibility in what we're getting in and supporting. So that's why it needs to have the focus, and that's why we're giving it that focus.
When you were Treasurer, you cut $2 billion from aged care. And
No,
then
that's what the Labor Party said.
No, you did.
No, the Labor Party said that.
No, you cut $1.2
No, I
million.
don't accept that. So if people want to put questions, they're not allowed to put lies. Okay?
Had $1.2
No,
billion
we're
cut.
increasing aged care funding by $1 billion
No,
every
answer
year,
the
and we
direct
put in
question,
place
Prime Minister.
compliance measures to ensure that public
The
funds
aged care
don't
funding
get
instrument
misused.
had $1.2 billion taken
this is
from-
why we're going to have a Royal Commission. No, I'm not ignoring the facts. That's why I'm calling
I've
a Royal
reported on it
Commission.
in two budgets.
No, if you just let me finish the question, finish the answer. This is why I'm having a Royal Commission, because I'm not going to put up with lies being told about what's happening in the aged care sector. Policy must be based on facts, not facts that are dreamt up, not facts that are misinterpreted, not facts that have agendas sitting behind them. A Royal Commission doesn't have any of those maladies. A Royal Commission will actually look at the actual facts, not at the agendas of advocates, not at the agendas of media, not at the agenda of politicians. A Royal Commission will be focused 100% on the needs of residential aged care residents.
Mr Wyatt, can you perhaps explain your comment to Four Corners?
In my comment to Four Corners, when I was asked about a Royal Commission, I said I would rather spend the money on frontline services for aged care than a Royal Commission at that point. But there are a set of circumstances that I've seen in aged care since that time, including in my own electorate, that takes me to the point that it is a crisis issue that individual families face when a daughter wants to get her father into aged care, has him placed, and then the aged care provider in that circumstance saying we can't take him. She went through incredible emotional experiences in trying to accept the fact that her father had been rejected. On that basis, I gave reconsideration to the need for a Royal Commission. It's something that I've been talking to the Prime Minister about in terms of senior Australians when I first took on the portfolio, and we had a lengthy discussion in Perth about senior Australians and what we needed to do. Scott Morrison as Treasurer.
But these were comments. You made these comments on August 16, Mr Wyatt. I mean, is it one case since August 16 that's changed your mind where you think it's a waste of time and money to have a high...
Let me correct you. Read the transcript. It says, I didn't support a Royal Commission. I would rather spend the money on... hold on. I would rather spend the money on frontline services that were important because amongst senior Australians in aged care... No, hold on, let me finish. Andrew, let me finish. We have senior Australians in aged care who need mental health support. We have senior Australians who need palliative care support. We need senior Australians who need support at home in terms of emotional and social wellbeing issues. That's where I wanted to put the money. That's where I wanted to look at the changes that we put into place to help those who are vulnerable. Now, a Royal Commission is necessary. It will build on what we're doing.
You can see, Mr Wyatt, that...
When will the Royal Commission begin? And are you prepared for what it will find? Whenever we have one of these Royal Commissions, we turn over rocks and we have all sorts of cockroaches, and it might end up looking very damaging for the coalition that this Royal Commission wasn't commenced much sooner.
Well, in the first 3 weeks of being Prime Minister, I've taken the action to initiate a Royal Commission to this sector. I don't know if I could have acted more promptly than that as a new Prime Minister looking into these areas. I think you're right. I think we should brace ourselves for some pretty bruising information about the way our loved ones, some of them have experienced some real mistreatment. And I think that's going to be tough for us all to deal with. But you can't walk past it. You can't not look at it. And that's what the government is ensuring that we don't do. That we actually, well, the date, we will seek to finalise the terms of reference, as I said, over the next few weeks. and then we would then seek to ensure that we have the commissioners appointed, and we'll be consulting on the appointment of commissioners and letters of patent. And well, this Royal Commission would take at least until the second half of next year. I have no doubt about that. Of course it will. Yeah,
Prime
it'll
Minister, Prime
start
Minister-
as soon as possible, but we're not going to rush the terms of reference and letters of patent and the appointment of commissioners. We'll be working carefully through this to make sure it gets set up on the right basis. There's some consultation to do now, and so that's the work immediately before us, and then I would anticipate that it would report sometime in the second half of next year.
You made your last budget an aged care budget, and then this week we saw you come out with the same ministers again and bring forward some of those measures with the $100 million starting immediately for aged care, and then we released one of the workforce strategy reports the next day on Thursday. It looks like you're clearing the decks and that maybe the budget in May didn't quite get the messaging right for older voters. Do you think the coalition has missed older voters over the last 5 years?
No, I think that's a very cynical view, Rick. I mean, the media are paid to be cynical, and that's fair enough, I get it. But what we've been focusing on over the last few weeks, as I've been in this role, I've been working with Greg and with Ken, as I've been confronted with this data. Now, it is true that in the budget, we put in place some very significant initiatives in our plan for a longer life for Australians. And it is true that we've provided another 20,000 places, another 106 million, which is toughening up the cop on the beat, providing capital grants to regional and rural residential aged care centres and improving the standards of care. So we're going to keep doing all of that. This is not a binary proposition. This is a comprehensive proposition, and that is the work we're doing will continue so people can have more choices as they grow older. Everything from their physical activity to working longer where they choose to and having that support, plus when they're at their most frail and their most vulnerable, then they can rely on the support they're getting. I mean, this is a never-ending task, and we will always have to be lifting the standards. That's why I make the point that our residential aged care, when you look at an international level, I mean, it is a very strong sector. There's no doubt about that, and we have a lot of things to both present to the rest of the world in how we go about this. But the best of industries, the best of sectors, the best of teams is always looking for ways to do better. And that's what this process is seeking to do. David?
Australians who are living in retirement villages, sometimes their issues may be different to those in full-time care. Sometimes their issues may be financial in terms of the arrangements that they make as they transition from one place to another.
Sure.
Should they be part of the Royal Commission as well? Should financial factors as well as care factors be investigated?
Well, I don't want to delay this by seeking to incorporate matters that fall under state jurisdictions. But where the states and territories wish to participate or wish to suggest an involvement or have the matters for which they're responsible brought into this, then the government would be very open to that. But I always take the position that you must be accountable for the things that you're responsible for, and that's what we're making the subject of this Royal Commission. That's right. There are a lot of other issues that go well beyond the residential aged care sector and in-home care. That is very true. But this Royal Commission will have a very strong focus. And it's important that we both do this and keep doing the things we're doing. I mean, in politics, in public life, you've got to learn from the things you've been involved with in the past. You all know my view previously about the Banking Royal Commission, and you heard what I said in the House last week. It has been my learning that it's important to go forward with the Royal Commission in this area because I can see the value that it will create in addressing these serious issues. But the other learning is this: you just don't stop and wait for a Royal Commission to finish. You keep doing the things that you know you can do each day to improve the lives of ordinary Australians. David?
What's this going to cost? Do you have an allocated budget for it?
At this stage, we're working that through with the Treasurer, but I mean, there's a standard cost that sits around this. I mean, the Royal Commission in the banking financial sector, we're looking at about 50 to 75, but that will all depend ultimately on the terms of reference, letters patent, the number of commissioners, the length of the Royal Commission itself and its reporting date. So there are a lot of factors there to take into account, and we'll be working that up and taking that through the usual budget process.
The staff issue is one that's often identified, and maybe the Minister can comment on this too. getting enough staff and qualified staff? I mean, what's your gut feeling? Do they need to pay more to get more?
Well, look, it's not for me to have a gut feeling. It's for me to commission a Royal Commission. So that's what I'm focused on. Now, the issues that you've referred to will be taken up, and they'll be clearly available there for the Royal Commissioner to be able to look at those issues and to address those in the Royal Commission and to do the work on that. And so I look forward to them undertaking that work and them reporting back. And then, as I say, not just the government, but one of the reasons I'm doing this is because there has been good bipartisanship on this issue over the last 8 years, hasn't it, Greg? Ken? I want to see that continue, and in the discussions I've had with the Leader of the Opposition, I believe he does too, and that means that you can allow the Royal Commission to proceed without all the fighting. I don't want us to fight about what's happening in aged care, I just want us to fix it.
You suggested that nurses and personal care workers, it was released on Thursday, are underpaid by about 15% compared to the midpoint in the industry. The Tune review also found that nurses were underpaid about 10% compared to hospitals. So we're not talking gut feelings anymore. You do have evidence that the pay rates are not.
We've got a Royal Commission going, and we'll continue to review all the evidence that is before us with the actions we're taking.
Can I say help Mr.
Sure.
Or just flag an interest in asking the question? I don't want to take you away from the Royal Commission. But is enough being done with the strawberry crisis we have at the moment? Is Queensland Health meeting the challenge? And are the strawberries safe to eat?
Sure. Look, firstly, this is a very vicious crime, and it's a general attack on the public, and it's also obviously an attack on a specific industry. Secondly, it's primarily the responsibility of the states through their policing mechanism, and Queensland has taken strong steps. I'm not critical of that. But thirdly, I have also, through my department, asked for an immediate appraisal by the Food Safety Authority of Australia and New Zealand. So I've made that request. In the meantime, though, the police through Queensland are taking steps, and I'm not critical of that. I think they are doing the right thing. But it's a vicious crime, and it's attacking the general public and a part of the agricultural sector.
Back on aged care, Prime Minister. Can you say now, there are no terms of reference, but is it clear that pay rates and staff ratios will be the subjects for the Royal Commissioner to look into and make findings on?
It's all encompassed in the areas I've already outlined, David. So I would absolutely expect it to be, and that along with all other issues like this, for example. One of the things that has been my observation for some time now is because more Australians happily are choosing to take the opportunity of in-home aged care places and to remain home for longer. I'm pleased to see that more and more in the housing industry we're seeing more private accommodation and other accommodation built for people's own homes where they can live longer in their own homes. That means you're there for birthday parties of the grandkids, you're there for important family events. Now, I know in retirement homes and I know in residential aged care facilities they're doing a wonderful job in trying to maintain as much of that home feel to where those Australians live. But with more Australians staying at home for longer, it means that when they're going into residential aged care, they are going in at a more advanced stage, at a more acute level of need. And that has real serious implications for this sector. So we want to get ahead of that problem. That's the constant feedback I get from people who are working in aged care facilities. It is the one issue, above every other issue, by the way. They put those they care for all the time above themselves in these things, and that's why they're such amazing Australians. But that's the issue they are most concerned about, and that they can meet the needs of those who are coming into those facilities now. And that's a real gear change from what we've seen over the last 20 odd years. It is a very different environment. Yeah, last one.
Not to announce that she's quitting Parliament until after the Wentworth by-election?
I don't speculate on media speculation. And that's going to be a golden rule. Thanks very much. Ta. Thank you.